Hello everyone, welcome back to the YouTube channel MEDICO'Z Factory. So today we are going to learn another section associated with pharmacokinetics, that is excretion. In case of doubt, please feel free to ask in comment section. So we will learn various routes of drug excretion. Drugs are converted to water-soluble metabolites and then excreted from body by following routes like renal, biliary, facial, pulmonary, skin, hair, sweat, saliva, and milk. So now let's study each route in brief manner. Let's study about renal excretion. Glomerular filtration. Rate of filtration through glomerulus depends on GFR, concentration of free drug in plasma, and its molecular weight. Drugs with low molecular weight are easily filtered. Heparin and insulin cannot be filtered because of its high molecular weight. Next is active tubular secretion. It is an energy-dependent carrier mediated active transport. Two carrier system. First is for acidic drug, example like penicillins, probenicid, thiazides. Drugs may compete for the same transport mechanism for prolongation of action of each other. Example like probenicid competitively inhibits the tubular secretion of penicillin. For basic drug, example is quinine, quinidine, and morphine. Last is passive tubular reabsorption. It depends on lipid solubility, pH of urine, ionization, and concentration of drug. Acidic drug gets ionized in alkaline medium and easily excreted. In poisoning of acidic drug, alkalization of urine by sodium bicarbonate, diuretics, IV fluid is required. In poisoning of basic drug, acidification of urine by ascorbic acid is required. Hence, acidic drugs gets excreted by basic medium, whereas basic drugs gets excreted by acidic medium. Highly lipid soluble drugs are largely reabsorbed. Their excretion is low. Now another mode of excretion is biliary excretion. After excretion in bile, drugs are reabsorbed back from gut and are carried to liver. This cycle repeats and it is called as enterohepatic circulation. Enterohepatic cycling prolongs action of duration of drug. Example like chloramphenicol and erythromycin. Now next is facial excretion. Unabsorbed portion of orally administered drug are eliminated through feces. Drugs not absorbed from GIT. Example like streptomycin, magnesium sulfate. Drugs which are secreted in bile but not reabsorbed from GIT. Example like corticosteroids and erythromycin. Next is pulmonary excretion. Lungs are main route of elimination for gases and volatile liquids. Example like nitrous oxide, general anesthetics, ether and alcohol. The elimination is dependent on the rate of respiration and pulmonary blood flow. Excretion through sweat, drugs like iodine, rifampicin, and heavy metals. And excretion through saliva, drugs like phenytoin and lithium. Now last is excretion through breast milk. Basic drugs like tetracycline, morphine, oral contraceptives, and ergotamine are excreted through breast milk. Toxic drugs to avoid is like anti-cancer drug, doxepin, primidone, amiodarone, theophylline, and phenothiazines. So we will keep this session till here. I hope this session are helpful to you. Subscribe the channel for such more content. You can use content provided here for university and competitive exams as well. Thank you. Bye bye.